Good afternoon, I'm Shawnee Yao and this is One News Now. The country logged more than 3,000 new COVID-19 cases per day in the last few days, which raises the question on whether or not stricter measures are needed to curb the surge. Joining us to discuss this is Dr. Ranjit Solante. He is the infectious diseases head of San Lazaro Hospital. Dr. Solante, welcome back on the show. What measures should we do to contain the recent spike in cases? Are the, nakasanayan nating minimum or standard health protocols enough?
Yeah, I think we have to intensify the localized lockdowns of concentration or clustering of cases in the city. So, for example, what PASA is doing doing these localized lockdowns instead of the whole city or the whole of the NCR will be put on a stricter lockdown. No? And second, we have to enhance the contact tracing, case detection, testing, and particularly isolation of those who are have symptoms and quarantine those who are in contact with those who have the symptoms or the index case. And I think what we have always emphasized, no, we have to intensify the adherence to the minimum public health protocol because I think there is really relaxation now. The poor in the compliance of this protocol is one very big factor. In fact, we have seen a lot of that in the workplace, not only in the workplace, but also in household. We mentioned that one of the common causes now of transmission is in the household transmission where sisters, brothers, including their parents, are being infected at the same time.
That's right. So dovetailing from infections within households, I mean, what can we really do inside our own households? Obviously, the Filipino case is that we really live with our family members. Should we start masking up inside the house?
That's what we want, especially for those who are going out every day. These are the carriers of this infection, and when they will expose their other household folks, like the vulnerables, the parents, the older members of the household folks. We have cases, a lot of cases like this, that the old folks and other members are not going out but only exposed to those who are regularly going out. And I think that's where we should also emphasize that as much as possible they refrain from doing longer interaction conversation with them, and at most if they can maintain the physical distance even at home, and as much as possible if they can also wear face masks if they will be doing longer interaction at home, then I think that should be better protecting this vulnerable, because most of our admissions now are the 50s, 60s, or even 70 years old population.
All right, thank you for that piece of advice, Dr. Solante. Now, other health officials also have said that putting certain areas under ECQ or MECQ is uncalled for, which is in line with what you said earlier, and that we just need to implement and enforce stricter protocols for now. So that was what I was asking you. In terms of us going outside for people that cannot avoid going out anymore for economic reasons or for errands, should we just really stick to the face mask, face shield, physical distancing, washing hands? Is that enough to curtail the spread of or the transmission of the virus?
Definitely it's not enough, because if you are in the workplace and your workplace has poor ventilation and you're not and your workplace doesn't have specific guidelines in infection prevention and control, where ventilation is important, engineering control is very important, and at the same time, we need to strictly implement and really inspect all this workplace establishment if all people there are complying, like the health declaration. We've been doing that for several months, and I think some of these institutions are already relaxing in their health declaration form before you will enter in the workplace. Everything should be again revisited and complied with.
Okay, so renewed vigilance is definitely called for. And what sort of adjustments, if any, should be made by establishments that are already operating, other public places? You did say that they were getting too relaxed. So apart from revisiting engineering and ventilation, any other protocols that we can enforce?
Yes, those who are even the mild symptoms, because I know some of them may have the mild symptom and they just don't report it appropriately to the authorities inside that workplace. I think they have to be honest with themselves if they have even the mildest symptoms, because these are the people that we have seen being positive, and then when you do the contact tracing, those who are infected being in the hospitalized because the workplace work colleague is having mild symptoms only, and I think that should really be very important now in the workplace.
What about your thoughts, Dr. Solante, on heightening restrictions again or enforcing some sort of travel ban for inbound travelers? Is this called for at this time?
The travel restriction, I think that will now be imparted among the local government unit on that particular area. That is the call for the LGU, and if they felt that this is more the appropriate way to really also strengthen the risk of transmission, then they have to revisit that policy again. No? And I agree with you that can also be an area where they have to also revisit.
All right, Doc, one last question before I let you go. I'm very curious, how's the situation in your hospital, in San Lazaro Hospital? We know it's a referral hospital and you're handling COVID cases. How's the capacity right now?
Yeah, we are not yet in full capacity, but there is like a 20 to 30% increase in the number of cases for the past 7 days, 5 to 7 days, and our ICU intensive care unit are all full, and we also have some critical severe patients in the ordinary room that cannot be accommodated anymore in the ICU. I think. That's one area that we have to focus now, managing these more severe and critical cases, and at the same time being more vigilant among our healthcare workers, because once cases will also be increased, our healthcare workers will also be the one that will also be affected. So we have to manage that, and at the same time, I hope we can also maintain the number of PPEs that we can provide for our healthcare workers who will be handling the cases.
All right, it looks like we're back to at least some point last year in terms of where we are in this battle. Thank you as usual for your time, your efforts. That was Dr. Ranjit Solante, Infectious Diseases Head of San Lazaro Hospital. And MRT3 management is advising those who are feeling under the weather to avoid riding the train. Rail Line Director for Operations Michael Kapati says that in the interest of public safety, those who are exhibiting symptoms or have possible exposure to the virus should be responsible enough to self-isolate and get tested. The Transportation Department also ordered the stricter implementation of health protocols in other modes of public transportation. Secretary Arthur Tugade says transportation enforcers and marshals will also make sure that social distancing is observed. Commuters are also reminded to continue wearing face masks and face shields, and also to avoid talking or eating inside a vehicle. Let's check out the latest vaccine stories from around the world. Pfizer and BioNTech's vaccine was able to neutralize a new COVID-19 variant spreading rapidly in Brazil. Scientists from the University of Texas said the vaccine's neutralizing ability was roughly equivalent to its effect on a previous, less contagious version of the virus. And in South Korea, health officials found no link between several recent deaths and AstraZeneca's vaccine. Officials looked into the deaths of 8 people with underlying conditions after experiencing adverse effects from the Oxford-developed shot. And Hong Kong has expanded its vaccination program to other priority groups like teachers and delivery workers. Around 93,000 people have been vaccinated in Hong Kong since the rollout began in February. And some people have contracted COVID-19 even after getting vaccinated. Bloomberg Intelligence's Sam Fazeli explains how that happens on Quick Take a Break.
Basically, there's only one vaccine that's ever been proven to be so-called sterilizing, and one that completely prevents any infection. And that's the smallpox vaccine, one of the very earliest vaccines we ever produced. So vaccines in general tend to have a very significant effect on your rates of infection, but definitely, which is the key thing that we're interested in, is stopping you from getting a severe disease or a critical disease. And that's what's most important here. So even if you look back at the trials of Pfizer-BioNTech and Moderna and J&J, there are people who continue to get COVID infections after the vaccinations occurred, even after the second dose. In the phase 3 trials of Pfizer-BioNTech, there were about 8 cases, I think, after a week after the second dose of the vaccine. But that compares to many, many more if you hadn't been vaccinated. And the key is that the vast majority of those so far have been very mild infections.
So does the vaccine still protect somebody who got COVID after the shot? Does that indicate at all that the vaccine is not working?
No, not at all. You'll never know the answer, but I'm hoping that the, again, vast majority of people who have an infection after having had a vaccine only develop what we could call the sniffles, or very mild disease with a slight cough, much like you get a normal cold. Nobody worries about that.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.